Медицинский центр корпорации Denas-ms
The Denas-ms Corporation Center has prepared for our tools users the manual on way utilization. In this manual, the main curing methods of various diseases, the biologically active zones and points for the operating influence atlas. The present video manual must be used as an addition to the manual on electric neurostimulation. The aim of the present video manual creation to train all the users to use the Denas-therapy apparatus. I consider this video manual to give a big service to all the Denas-therapy users. It will bring you health.
Здоровья. Современная медицина знает.
The modern medicine obtains great knowledge about man and can do very much. The threat of horrible epidemics is far in the past. The different directions of medical science have developed. At present moment, serious operations on organ transplantation, various diseases that used to be incurable are carried out. At present moment, a blind man can return his vision with the help of modern medicine. A man after a serious road accident and inner organs injuries can recover his organism and so on. But one fact is indisputable. The 21st century medicine will take into its summary one more interesting factor – electricity. For centuries, people strived to find that energy which could be used in everyday life. With the appearance of electric energy, many tasks had been solved. All the techniques, all the daily life is based on the use of electric energy. Medicine was not left aside, and at present moment it utilizes electricity, electric energy. The first experience of electricity usage can be seen in different methods of research. Electric encephalography, cardiolography and so on. It is necessary to use the electric impulse as a curing method at present time. The dynamic electroneurostimulation method uses the electric impulse. Dynamic electroneurostimulation is a new method of treatment that uses electric impulse as a main curing factor that coincides the physiological neurosignal of human body in its characteristics. Thanks to it, it is possible to influence the biologically active points, biologically active zones of human organism and to achieve the regulation effect. With the help of dynamic electroneurostimulation, the organism-dependent forces are activated and directed to the pathology source elimination. The two-wrench electric neuroadaptive stimulator was created as a result of obtained clinical and experimental work experience in Moscow and Yekaterinburg clinics. The corporation's new technological development favorably differs from the prototype, not only in design and ergonomics, but in advanced parameters of electric signal that is maximally close to the endogenous neurosimilar impulse with the predominance of information component. This allows to achieve the anti-stress reaction effect of training and activation. The availability of biological feedback of the apparatus allows to carry out the diagnostics of the most efficient influence zones and to fulfill individual aid to each patient in case of every disease in each concrete time period. The influence time is regulated by the organism itself in accordance with its need. As a result of the apparatus work, we achieve the synchronization of integrative relations of the organism regulator systems, thanks to local, segmental and common reactions. The tissue's reserve functional elements mobilization take place that leads in the long run to recovery of the previously damaged functional ability, and in the range of cases it also leads to the morphological integrity recovery.
Динамической электронейростимуляции посвящены
Numerous scientific works, medical conferences, scientific articles, various medical literature is devoted to the dynamic electrical neurostimulation. This method has found its application in different spheres of medicine, in hospitals, in children's hospitals, in polyclinics, in sanatoriums. But thanks to its wonderful qualities, application safety, utilizing easiness, high efficiency and dynamic electric neurostimulation is mostly applied in daily life. These apparatus are assigned first of all for utilizing in home everyday life conditions. These apparatus are home doctor. The application point of Denas-therapy, so to say, the influence with the low-frequency electric signals, is the improvement of adapting-adjusting abilities of organism. In other words, the organism that given environmental conditions, take into account the inner processes taking place in the organism, begins to function better, it adapts to the given conditions better. The organism regulatory abilities increase and influence, and result is better existence. The organism better functioning in the given condition in the given time. In case of respiratory organs diseases, the patient can suffer from cough, breath shortness, pain in the chest connected with breathing, where can be symptoms of weakness, indispositions, temperature rising. In case of these complaints, we begin to work as usual in case of any other problem, under any other pathology. The Denas-therapy principle is the work on complaints. If a man is concerned with breath shortness, suffocation, we proceed the fishbone zone on the back, the front surface of the neck, anti-allergic zones, the zone of upper chest. In this case, the mucus appears, so the cough becomes productive, in breath improves, the suffocation stops. The criterion of the work stop is the patient's state of health improvement. Bronchial asthma is a chronic inflammatory disease of the respiratory ways accompanied by hyperactivity of bronchi and leading to the development of reversible, spontaneous or under the treatment influence bronchial obstruction. If the allergen molecule comes to the body, in most cases it happens through the lungs and react with an antibody connected with any cell. This meeting causes the whole range of phenomena in which all the lungs tissue takes intensive part. The smooth muscles of the finest bronchial ways are in the spasm statement that decreases the volume of air coming to the alveoli. As a result of this process, in case of gas exchange between blood of lungs, capillary and alveoli, less oxygen comes to the blood. The mucus laying in the inner surface of the bronchi becomes swollen and emit a large amount of bronchial secretion, because of which the air loading is partly blocked. The numerous cells producing the mucus in bronchi in normal situation are very useful, keeping the wall's elasticity, but in case of bronchial asthma fit, the secretion plugs up the respiratory ways. The mucus becomes becomes viscous and dense, that leads to its fluidity decrease and stopping bronchioli and bronchi. These factors explain the breathing shortening, cyanosis, wheeze and whistles while breathing, and convulsive breath-in. In case of influence by Denas and scanner apparatus, the microcirculation of blood in bronchi increases. This contributes to the bronchi smooth muscle spasm, mucous membrane swelling elimination, and the mucus outflow through the coughing reflex improvement. The method of bronchial asthma feet elimination. The fishbone zone, the conforming zone of the background direct projection of the broncho-lung tree and lungs. Operation is held in continuous mode at comfortable energetic level till the achievement of clinic dynamics, till the cough softening, mucus outflow and others. The apparatus movement speed 1 cm per second. One tries not to miss a single centimeter of skin. If there is an opportunity, it's possible to operate 2 apparatus. Then the breastbone zone is processed till 5 minutes. Continuous mode, comfortable energetic level. The upper chest zone, continuous mode is used. Minimal or comfortable energetic level. Speed 1 cm per second. The underjaw zone is processed tonsil projection. Operation is held symmetrically on both sides. The continuous mode, comfortable energetic level. Operation time 5-7 minutes. If there is a respiratory disease, the nose zone is processed. The continuous mode, comfortable energetic level, operation time 5-7 minutes. After the bronchial asthma feet elimination, the cause treatment is held. Additionally, common central zones are involved, 6 points and 3 tracks. The 6-point zone points are the places of the outgo of trifacial nerve branches on the face. Operation is held in dose mode, moving the apparatus electrodes horizontally till the achievement of light sound signal. On the 3 tracks zone, operation is held in dose mode, in minimal or comfort energetic level, till the achievement of light sound signal. In case of deviations on time, on the central track, the apparatus is switched into continuous mode. Under the operation on two other symmetrical tracks, the asymmetrical zones are divided. Having found them, the operation is transferred into continuous mode, comfortable energetic level, and the operation time is 2-3 minutes. Then periphery zones are treated on the method of gloves and socks. If a man has a vascular pathology or extremity swelling, the operation is held from periphery to the center as if putting on gloves and socks. One extremity is treated in dose mode on comfortable energetic level. In case of bronchial asthma fit, when a man is alone at home, the zone can be treated on two-jog system of conformity on the palm and foot. The continuous mode, maximal energetic level. Operation is held till the statement improvement.
Заболеванием органов.
The diseases of blood circulation organs include ischemia disease of heart, the hot inflammatory diseases, myocarditis, endocarditis, pericarditis, hypertonic disease, heart failures, the heart rhythm breakage. In case of these diseases, the patient can be bothered by the pain in the heart zone. The pain can have various character: compressing, squeezing, stinging, whining, heart-beating feeling. Headaches, dizziness, nausea can take place. In case of these symptoms appearance, the operation is held in the heart direct projection zone. It is behind the area between left shoulder blade and spine. The neck collar zone is treated taking into account the arterial pressure. The direct projection of complaint is treated. In case of headache, the place of maximal painfulness is treated. In case of hypertonic disease, when the arterial pressure rises and headaches, dizziness and nausea appear, the operation is held on the hair part of head, in direct projection, continuous mode, comfortable energetic level. The neck collar zone is treated downwards, the heart zone, Sujok zone, kidneys and aorta is treated. The operation stop criterion is the patient statement improvement. The operation is not held till the pressure normalization, but till the time when the patient feels better. The pressure can decrease later, yet 10-20 minutes the pressure can remain high when it gradually comes to the norm. Hypertonic crisis is a quick significant arterial pressure rise, causing the abrupt statement deterioration and the possibility of dangerous complication. It's usually preceded by the nervous breakdown, worrying, quarrel, exciting use. But the nervous system of a man subjected to crisis is known by its high sensitivity, excitability, and even a trifle excuse can cause the nervous breakdown. Heart and vessels react to the mood changes. The exciting brain cells transmit the alarm signal to lower structural units of the nervous system that is responsible for the heart and vessels function, and also to the inner secretion glands emitting hormones. The great role in the arterial pressure regulation belongs to catecholamines, adrenal gland hormones, adrenaline and noradrenaline. Both of them influence the heart and vessels, but in different ways. Adrenaline makes the heart contractions more frequent and strong. Noradrenaline mostly increases the little arterial tonus. Under its influence they contract, their shafts narrow. The hormones play and directly influence the arterial pressure. Under the Denas-therapy influence on the human organism, the heart comes into normal rhythm, the vessels walls widen and the pressure normalize. In case of heartaches, the operation begins from the background heart projection. The area of the man's palm size is treated. The continuous mode, comfortable energetic level. Operation is held till the ache elimination. The heart side projection is treated further. The zone square is similar to the size of patient's palm. The continuous mode, comfortable energetic level, the operation is held till the ache elimination. Only in reanimation purpose, the front direct projection of heart is treated. The continuous mode, If the patient is unconscious, the operation is held on the maximal energetic level till the patient's statement improvement. The neck collar zone. The operation is held on minimal energetic level, moving apparatus with a speed of 1 cm per second. The operation time is 10–15 minutes. Further, the carotid direct projection is treated. First one determines the carotid pulsation with the help of a hand, the continuous mode, minimal energetic level. The influence time is 1–2 minutes for each zone. The Sujok zones of conformity of heart and neck collar on the wrists. The continuous mode, comfortable energetic level, operation is held till the statement improvement. While treating the hypotonic crisis, the area of kidneys and ureter is straightened. The apparatus electrodes are smoothly moved by the skin in continuous mode by comfortable energetic level on both sides. The speed is 1 cm per second. In case of lower extremities veins diseases, varicose diseases, thrombophlebitis, leibothrombitis, when a patient may be bothered by the feeling of heaviness, discomfort, pain in legs, lower extremity swelling. The operation is held upwards, in the direction of vein bloodstream, from the fingertips till the talocrural joints on the feet and upwards by the shin and thigh on the line, by outer, inner and black surfaces of thigh and shin. After the apparatus treatment, it is possible to use the elastic bandaging or wearing special stockings, tights with binding effect. The lower extremities veins varicose expansion is the expansion of superficial vein accompanied by the valves unsoundness and the bloodstream breakage. To the disease development contribute pregnancy, obesity, long-standing bone weakness and junction tissue. In case of shin and thigh muscles contraction, the deep veins are squeezed and the blood from them goes to proximal parts of the vein system. The sound valves of communicant veins do not allow the blood to intrude into the superficial vein system. In case of varicose vein expansion, the vein pressure rise leads to the valves unsoundness and the communicant veins, as a result of which, under the muscle contraction, the blood under great pressure comes from the deep vein into superficial one. While the disease progresses exhaustion, the feeling of heaviness in legs, cramps and gastrocnemius appear especially in the evening and sometimes at night. The swelling usually appears in the evening, mostly after a long standing. After the night rest, the swelling absolutely disappears. In the time flowing together with the varicose expansion progress, the trophic damages appear. They mostly localized on the inner surface of the lower third of shin. In case of cross influence of Denas and scanner apparatus, the microcirculation of blood improvement take place, as a result of which the valve's work improves and the blood outflow recovers. The operation of apparatus is necessary to hold before sleep. After the session, the patient shouldn't be standing. The extremities should be well bandaged. It's better to begin the treatment course from lumbar sacrum zone, 3 or 4 sessions, and then it's possible to operate on the suffering vascular direct projection. During the session, the lower extremities should be lifted. The operation is not held on the suffering vascula itself, but the soft tissue around it are treated. The area is treated upwards. Then the apparatus operates in individual dose mode on the inner, side, back and front surfaces. If there are swellings, the extremities are treated in continuous mode upwards. The speed is 1 cm per second. The underneath it is not treated. In case of arterial diseases, when a patient suffers from the pain in the extremities, the symptom of alternative lameness is typical when the pain appears while walking in case of physical loading. There may be the feeling of cold sensitivity in extremities. Legs are pale, cold, a little thinned. In case of these problems, the operation goes in the arterial blood circulation direction. So to say, in direction from the center to periphery, downwards, from ankle joint to the fingers ups on feet, in direction of soak putting off, and downwards, by thigh and shin, on the lines of outer, inner, side and the back surface of thigh and shin. Obliterating endothelius, renal diseases, hyperexia, small vasospastic disorder of arterial blood circulation of wrists and feet. The arterial vascular inner covering inflammation develops. It thickens and the artery shaft narrows. Even the whole vascular can get obliterated. This leads to blood feeding of organs and tissue breakage. As a result, they do not receive the necessary amount of oxygen and nutrient substances. Mainly the wrist fingers, feet fingers are damaged. Nose and ears and chin are damaged less frequently. These diseases are characterized by symmetrical damage with the consecutive change of skin color, paling, cyanosis, blushing. During the fit that lasts from several minutes to several hours, paresthesia, that paleness of skin, fingers freezing can be noticed. In the interfit period, the wrists are cold, cyanotic, humid. In case of Denas-therapy, influence of human organism, the vascular walls widen and the blood nutrition of extremities normalizes. treatment is better to begin from lumbar sacrum zone, when the lower extremities are treated by the apparatus. The operation begins from the lowest zone, from the ankle joint to the fingers tips. The mode is continuous. Energetic level is minimal or comfortable. Each zone is treated during 1-2 minutes. Each leg is treated consequently and from all the sides. The treatment level rises with each session. The operation begins from radiocarpal joint till the fingers tips, continuous mode, comfortable or minimal energetic level. Each zone is treated during 1-2 minutes. Each hand is treated consequently and from all sides. The treatment level rises with each session. In case of digestion organs diseases, the patient may be subjected to the pains in stomach, and the pain is often connected with the food consumption. It may appear when stomach is empty or sometimes after the food consumption. The main rule of Denas influence is the operation on complaint. In other words, where it hurts, there the apparatus should be put. In continuous mode, on comfortable energetic level, the maximal painfulness place is treated. In case of stomach and duodenum ulcer diseases, the pain is usually localized in the upper parts of stomach. In case of such complaints, the epigastrial area is treated till the pain eliminates. The stomach ulcer is the breakage of the tissue's integrity in one or several points of stomach. The ulcer may touch only the mucous cover or perforate the organ whole wall. The stomach juice properties change is determined by its acidity increase. It occurs because of increase of chloride content as a consequence of its creation and emission by so-called facing cells of the stomach mucous cover. The disease is usually stimulated by the nutrition regime breakage, dry food consumption, not indeterminate hours. It's impossible not to take into account hereditary subjection to the ulcer disease. Besides, there are bacteria having to do with the ulcer development, Campylobacter or Helicobacter, a range of clinical reflections, whitenesses about the appearance of sharpening or the ulcer disease. The main of these factors is pain. It's usually accompanied by dyspeptic disorders, nausea, vomiting and acid stomach content, heartburn. In case of cost treatment by Denas and scan apparatus, the blood microcirculation in stomach recovers, as a result of which the regenerative processes in mucous cover accelerate. The stomach ulcer pain fit. The epigastrial zone is treated in continuous mode. Energetic level is comfortable or maximal. The treatment area is of human palm size. The apparatus can be transferred or slowly moved. On the pain area, the apparatus should stand 10 or 15 minutes till the pain elimination. After the pain elimination, the course treatment is carried out. The session begins from the front direct stomach projection. Further, the back direct stomach projection is treated. The operation is held in dose mode. In case of pain presence, the area is treated in continuous mode. The stomach area is treated every session. Other digestion organs in a session or each third session. The front direct liver projection is treated in individual dose mode. In presence of stones in gallbladder, the apparatus is put on the front liver surface. The pancreas front direct projection is treated in individual dose mode. The pancreas back direct projection is treated in individual dose mode. The liver back direct projection is treated in individual dose mode. In case of liver and gall outflow waste diseases, the patient is bothered by pain in right hypochondrium. The pain may be weaning, there may be feeling of heaviness, discomfort, and there may be sharp intensive feet pain. Besides, there may be nausea, vomiting, bitterness, dry feeling in mouth. In presence of these symptoms, the liver area, lower part area of chest on the right is treated. In this case, liver is treated from all the sides, from the front, side and back. The treatment is held till the statement of patient improvement, till decrease or elimination of the pain feeling. Chronic hepatitis is the disease of a virus, autoimmune or toxic nature that is characterized by the liver inflammation with necrosis and developing fibrosis. The patient may suffer from weakness, nausea, pain in the upper part of stomach, icteric, less frequently vascular starts, increase or decrease of the liver size, splenomegaly. On late stages, there may be portal hypertony signs noticed. In serum, the bilirubin content increase, transaminase and alkali phosphatase activity, but this indice can be in norm. In case of Denas-therapy, influence on the direct liver projection and organism on the whole, the anti-inflammatory, holagogue, hepatoprotective and hepatoreparative effects. The liver ferments activity level decreases quicker in case of its initial increase, usually before the bilirubin level normalizing in blood. The liver front direct projection is treated in continuous mode on comfortable energetic level. The apparatus must be transferred after 5-7 minutes on point or moved by 1 cm per second, till the elimination of significant decrease of complaint. In presence of stones in the gallbladder, the apparatus is not put on the front surface of liver in hypochondrium. The back direct projection of liver is treated in continuous mode on the comfortable energetic level. In case of chronic pancreatitis sharpening or in case of the sharp pancreatitis, the patient is bothered by the pain in the upper parts of stomach, often irradiating into the back of belt or half-belt type. We call these pains belting ones. In presence of such a symptom, the treatment is carried out in the area of maximal pain, and the pain irradiation zones are treated too. So to speak, where there is pain, there should be the apparatus. Chronic pancreatitis. The factors causing the sharp pancreatitis may be the reason of chronic pancreatitis characterized by stable structural changes in gland tissue. In case of chronic pancreatitis, the pains in epigastriae are the most characteristic. They irradiate into back and forth alcohol and heavy fatty meal consumption. Sometimes the signs of pancreas ferments deficit are noticed. That leads to steatorrhea, nutrition insufficiency and slimming. The swelling and fibrosis of the pancreas head are revealed in obstruction of the pancreas part of common gall canal and sometimes in hepatitis. In case of Denas can influence on the direct projections of pancreas, the emission of pancreas juice and insulin by the organ normalizes. The pancreas front direct projection is treated in continuous mode on comfortable energetic level till the significant decrease of the complaint elimination. The pancreas back direct projection is treated in continuous mode on comfortable energetic level till the significant decrease or complaint elimination.
При заболеваниях кишечника.
In case of intestines, under the irritated intestines syndrome, under the non-specific ulcer colitis, under the Crohn disease and other intestines diseases, the operation is held taking into account of character of stool. The rules are as follows. In case of normal stool or under subjection to constipation, the operation is held on the direction of content in big intestine. The operation on intestines can be made in several ways. In presence of pain feeling, the liver zone is treated first. In this case, the apparatus is transferred or moved on the lever area in continuous mode and then moving the apparatus. The operation is held from right to left, upwards, from the lever to overpubic area. In absence of pain, it's possible to operate by gliding movements, rotary movements clockwise, by spiral from navel to the stomach periphery and then in the same direction continuing the rotation to the navel. The operation time is 20-25 minutes. In presence of implementation to stool leniency or under-diarrhea syndrome, the operation is held in the opposite direction. In the pain presence in continuous mode, the apparatus is transferred from overpubic zone through the left hypochondrium to the right hypochondrium, and the operation finishes by the liver area treatment. In absence of pain, the apparatus is rotated spirally anti-clockwise from navel to the stomach periphery, and otherwise rotating the apparatus in the same direction. The ulcer colitis is the ulceral damage of the mucous cover of the big intestine beginning with the rectum. It's characterized by prolonged flowing and accompanied by heavy local and system complications. Multiple and overlapping ulcers of a big intestine mucous cover lead to an expressed intoxication, emission of a big amount of mucus, blood and pus from the rectum, sharp breakage of exchanging processes and septicopia, damage of skin, eyes, joints, liver and so on. Because of the high penetratability of the ulcer, process damage intestine wall, and directly as a result of perforation of ulcer, the local limited or pured peritonitis. At the beginning, the liquid stool with the addition of mucus and blood appears, common weakness is noticed. The diarrhea can progress 20-30 times a day and lead to dehydration, exhaustion, sharp anemia, electrolyte exchange breakage with spasmodic syndrome, the peritoneum irritation, the stomach blister, sharp toxic dilatation of intestine. System damage can be noticed. In case of cross influence of Denas and scan apparatus, the microcirculation of blood in intestines improvement take place, as a result of which the regenerative processes in the mucous cover of ill organs accelerate. The intestine's front direct projection is treated in individual dose mode. From the navel, the zone spirally expands and ends on the front direct projection of sigmoid rectum. If the stool is normal or if the patient has constipation, the operation is held clockwise. If there is a diarrhea, anti-clockwise, from end parts of intestine to the navel spirally. In case of the disease sharpening, the operation is held in continuous mode. In case of remission, in dose mode. Further, the lumbar sacrum zone is treated from the first lumbar vertebra till the last sacrum one. The asymmetry zones are revealed in individual dose mode. If they are found, the apparatus is transferred to continuous mode and the operation is held for 2-3 minutes. The zone is treated on two-jog system of conformity to intestines on the hand and foot. The continuous mode, comfortable energetic level, 2 minutes.
При заболевании почек и
In case of kidney and ureter diseases, the patient is often bothered by the pain in the lumbar area that frequently irradiates into groin, into the lower part of stomach. In presence of such a symptom, the lumbar area is treated in continuous mode on the comfortable energetic level. The operation is held till the decrease or elimination of pain feeling, and then the ureter's projection is treated. In this motion in continuous mode, the apparatus is transferred downwards, from the back to the front to the other pubic area. The feat of urinary calculosis. In stone formation, a big part is played by the metabolism breakage, endocrine system disbalance, breakage of kidney, hemo and urodynamics, and the inflammatory process in the kidney pelvis. The patient presents the complaints of pain in lumbar, sometimes a kidney colic appear, hematuria, leukocyturia, outflow of fine stones with urine. The operation of Denas and scan apparatus leads to improvement of urine analysis, kidney function, and the morphological statement improves. In case of coarse treatment by the apparatus of the urinary calculosis, the stones in kidney begin to become friable gradually, diffuse and go out in the form of sand, even without pain fits. The operation is held on the lumbar sacrum area with the accent on the kidney direct projection, the continuous mode, comfortable or maximal energetic level. The operation time till the pain syndrome elimination. Further, the area of kidneys and ureters is treated. The apparatus electrodes are smoothly moved by skin in continuous mode on comfortable energetic level from both sides. The speed is 1 cm per second. Sugar diabetes is the disease connected with the breakage of carbohydrate exchange. In this case, the sugar level in blood increases. Sugar appears in urine. In case of sugar diabetes, as with any other disease, the operation should begin on the patient complaints. The patient is often bothered by the pain in extremities or diabetes angiopathy type. In presence of such symptoms, the feet are treated in the direction of soak putting off, in continuous mode from the ankle joint to the fingertips. By thigh and shin, the apparatus is moved downwards. Often the vascular or vis retina in diabetes retinopathy. In this case, the vision sharpness decreases. In presence of such complaints, the area of vis is treated through the closed eyelid. The apparatus is put on the eye in continuous mode for 2-3 minutes on minimal energetic level. In case of sugar diabetes, the diabetes nephropathy develops. In this case, the patient often and heavy urinates. In presence of such symptoms, the kidney and ureter's projection is treated from both sides. Sugar diabetes without complication is a clinical syndrome determined by the absolute or specific insulin insufficiency. It is characterized by chronic hypoglycemia with the development of decompensation of all metabolism tiers, both in sharp and chronic form. The known specific symptoms that can be met in any type of sugar diabetes are being thirsty, polyuria, polydipsy, skin pruritus. In case of course influenced by Denas and skin apparatus, the partial or complete recovery of insulin-producing cells take place. In case of insulin-dependent sugar diabetes, it's possible to decrease the dose of medicines and in the range of cases to refuse from medicines at all. In case of any type of diabetes, very good results are noticed in curing of diabetes neuropathies and periphery blood circulation breakages. One of the pancreas direct projection is treated in dose mode on minimal energetic level. During the operation on the back direct projection of pancreas, the softer effect is noticed. Then the liver direct projection zone is treated. Continuous mode, minimal energetic level. The operation time not more than a half from a length of operation on the gland direct projection. In case of female genital system diseases, the patient is often bothered by pain in the lower part of stomach that rather often irradiate into anus area, into groin, into genital organs. There can be the menstrual cycle breakage. alcohol feeling, sweating, fever feeling. In presence of such symptoms, the maximal pain place is treated. The overpubic area is treated. The area of the groin crease, perineum, the sujok conformity zones can be treated. Lactation mastitis is a non-specific inflammation of dairy gland. It appears mostly in lactation period. The entrance gates of infection is the nipple and around nipple field fractures. The milk stagnation is important for the mastitis development. The stimulant is golden staphylococcus in combination with other coccus flora and Escherichia colic. The lactation mastitis often appears on the first afterbirth month of the first pregnancy. On the background of milk emission, decrease the expressed pain in the gland, temperature rise, algopia. The dairy gland is swelling, becomes painful, and in the range of cases, the skin hyperemia appears. The operation by Denas and scan apparatus leads to increase of blood microcirculation in the dairy gland that encourages the fracture healing, inflammation elimination, and lactation stabilization. The direct projection of the inflammation source is treated. The continuous mode, comfortable energetic level. The operation is held till the pain decrease. Then the ill and sound dairy gland is treated in dose mode from the periphery to nipple. The whole gland is treated from all the sides from periphery to nipple. The electrode can be transferred or moved. The movement speed is 1 cm per second. In case of lactostase, the whole gland is treated for 10-15 minutes before feeding or decanting. The dairy gland segments are treated in individual dose mode from the spine to periphery. The segment width is equal to the width of a palm. After the light sound signal, the apparatus is transferred. The right and left sides are compared. In case of asymmetry, the apparatus is switched to continuous mode and the area is treated for 2-3 minutes. The ovary zone is treated. If there is no pathology, the operation is held in individual dose mode. If the asymmetry zones are revealed, the apparatus is switched to constant mode and the zone is treated. Fibromyoma is a benign tumor of the muscle tissue. The myoma development reasons are not investigated to the full. A certain role belongs to hyperestrogeny, encouraging the muscle fiber growth and hypertrophy. The main clinical expressions of myoma are as follows: uterine hemorrhage in case of under-mucous ganglion position, the near organs squeezing symptoms, frequent urination, constipations, pains in case of blood-feeding breakage and necrotic changes in ganglions, reproductive function breakage, premature delivery, sterility, birth activity breakage. The operation of Denas and scan apparatus leads to positive results. The fibromyomas in case of initial uterine dimensions with the pregnancy term till 8-9 weeks, the apparatus operation initially leads to elimination of clinic expression and then to full regression of tumor. Fibromyoma in case of uterine initial dimensions with the pregnancy term more than 10-11 weeks, the apparatus influence improves the woman's statement, clinic expression disappear, the tumor dimensions decrease till 4-6 weeks. In case of female genitals diseases, if there is a process, the operation is held in continuous mode in the pain projection till 10 minutes. Then the zone from navel to pubic is treated. First, the central line is treated, and then the treatment is made in fan form. The asymmetry zones are revealed in individual dose mode. If any are found, the apparatus is transferred to continuous mode and the zone is treated for 2-3 minutes. In case of gynecological diseases, the lumbar sacrum zone is treated. The zone is limited by the first lumbar vertebra and sacrum. The asymmetry zones are revealed. In case of such zone revelation, the apparatus is transferred to continuous mode and the operation is held for 2-3 minutes. The zone is treated on Su-Jok system of conformity to gynecological organs. Continuous mode, comfortable energetic level, 2 minutes. The additional zone in case of gynecological diseases is the inner surface of thighs. Here the modes can be combined. The back of feet is treated in individual dose mode.
При заболеваниях мужской половины
In case of male genital sphere diseases, the patient can be bothered by discomfort feeling, winning pain in the lower part of abdomen. There can be frequent urination or, in the contrary, difficult urination, sexual function breakage. In presence of these complaints, the pubic zone, perineum zone, ovary and sacrum zone is treated. In case of pain while urination, the treatment is held by the ureter channel course, directly by the penis course.
полового члена.
Prostatitis. The infection comes into prostate by hematogenic way from any inflammatory source in the organism or directly from ureter in case of inflammation development in it or after instrumental examination. The painful and frequent urination, pain in perineum and sacrum, temperature rise is noticed with the patient. The prostate swelling can lead to sharp urination delay. Under the coarse influence of Denas and scanner apparatus, the clinic expressions disappear, the prostate decreases, urination recovers. First, the complaint direct projection is treated. Pubic, perineum, lymphatic, ganglions and others, in dose or continuous mode, on minimal or comfortable energetic level. Further, the lumbar sacrum zone is treated from the first lumbar vertebra till the last sacrum one. The asymmetry zones are revealed in individual dose mode. If they are found, the apparatus is transferred to continuous mode and the operation is held for 2-3 minutes. Mycolas rhombus is treated in individual dose mode. water, the area of kidneys and ureters is treated. The apparatus electrodes are smoothly moved by skin in continuous mode on comfortable energetic level from both sides. The speed is 1 cm per second. In operation with children, it is necessary to follow the next rules. The smaller children are, the shorter must be the procedure. For the children of the first life year, the procedure lasts during 5–10 minutes. Till the age of 5–6 years, till 10–15 minutes. Up to 12 years, 25–30 minutes, minimal adult norm. Beginning from 12 years, the procedure is held on adult pattern, so to say, to 40 minutes. The next rule. The smaller child is, the less energetic level is used. With the newly born babies, the operation is held on minimal energetic level. If a child has an allergic dermatitis, or as it's usually called, diathesis, the skin zone, maximal revelation zones, intestines area and anti-allergic zones are treated. The allergic dermatitis or diathesis is an inflammatory skin damage resulting from outer factors' influence, chemical, physical, biological. Allergic dermatitis resulting from the facultative irritants appear only to those who are hypersensitive to them. Most frequently, the allergic dermatitis develop in case of repeated influences on skin of cleaning powders, cosmetics, insecticides, medicines, chrome salts, nickel and so on. In case of allergic dermatitis, the inflammatory phenomena in the damaged source are clinically similar with those in case of eczema. Hyperemia find the cycles, wetting crusts, shelling, and may spread over the skin area that was subjected to irritant. Denas and scanner operation leads to elimination of the skin irritation indices and to immunity increase on the whole. The operation begins on the areas of greatest skin damage. The apparatus is transferred but not pulled. The continuous mode, minimal energetic level. The operation is held during 30 seconds on each area. The elbow flexion is treated in the same way. The apparatus treatment of the liver direct projection area. Individual dose mode is held till the appearance of light sound signal. The energetic level is comfortable. The gallbladder direct projection is treated. It's the gall outflow method. The mode is individual dosed. Energetic level is comfortable. The intestine direct projection is treated. If the stool is normal or there is constipation, the operation is held spirally clockwise. If a child has diarrhea, The operation is held anti-clockwise. From the navel, the spiral is unrolled. The mode is continuous. Energetic level is minimal or comfortable. Motion is by 1 cm per second. In case of diarrhea, the spiral is twisted. The mode is continuous. The energetic level is minimal or comfortable. The speed of operator's motion is 1 cm per second. While treating the hormonal zone jugular pit, the apparatus is put on the angle to the body. The mode is continuous. Energetic level is minimal. Operation period is 2 minutes. The kidney and adrenal gland zone is treated from both sides in individual dose mode on comfortable energetic level. The 7th neck vertebra zone is treated in individual dose mode on comfortable energetic level. The common zones, 6 points and 3 tracks are treated each 3rd and 4th session. The 3-track zone is treated in individual dose mode on comfortable energetic level. The 6-point zone is treated in individual dose mode on comfortable energetic level. In case of catarrhal diseases, for example in case of rhinitis, the nose wings are treated in continuous mode on minimal or comfortable energetic level for 3-5 minutes. If a child has a sore throat, the treated zones are nose, tonsils, projection, submaxillary area, neck and thyroid gland zone. They are treated in individual dose mode. The painful areas are treated in continuous mode during 5-10 minutes. Further common zones are treated: jugular pit, the sternum zone and the 7th neck vertebra. The mode is continuous. Minimal or comfortable energetic level is held during 2-3 minutes. During the session, not more than 2-3 influence zones are treated. If a child has a sharp bronchitis, the session begins from the fishbone zone treatment. The operation is held slowly along the bronchial tree course upwards. The mode is continuous. The motion speed is 1 cm per second. The hormonal zones are treated each third session. The adrenal glands zone is treated in individual dose mode. The immunity area, 7th neck vertebra, is treated in individual dose mode. The tongue zone is treated in case of digestion tract diseases. The mode is continuous. The energetic level is minimal, 2-3 minutes.
При неврологических заболеваниях
In case of neurological diseases, the patient is bothered by headaches, dizziness, where may be nausea, vomiting, consciousness breakage. In such cases, the maximal pain place is treated. The apparatus is transferred by the hair part of the head after the hair separation. The suit-jaw conformity zones can be treated.
зоны соответствия по суджок.
Ischemia insult is a local ischemia of the brain, usually revealed by the sharp development of focused neurological damages. The ischemia of brain development can be caused by thrombosis or embolism of outer or inner skull arteries. In rare cases, by hypoperfusion of brain after systematic hemodynamic damages. The insult in 20–30% of cases is preceded by the transitory ischemia attacks, common breakages of brain blood feeding. Ischemia insult usually develops during several minutes or hours, rarely during several days, and reveals in movement, speech or other focused neurological damages. The breakages of consciousness, vomitings, intensive headaches are not noticed in most cases, except those ones where there is an infarction in the brainstem, cerebellum, or in case of broad hemisphere infarctions. In case of influence of Denas-therapy on human organism, the arterious wall widen or recover, thus the brain blood feeding normalizes. In case of headache, the maximal pain area is treated till the decrease of elimination of pain. The mode is continuous. The energetic level is comfortable. Each point is treated from 30 seconds to 1 minute. If the pain is spread, the temple zone, border with the hair part of head, is treated. forehead is treated in the same way. Then the hair is separated and the line connecting the nose bridge with the sound neck vertebra. The next treat line is the line from ear to ear for the head top. The mode is continuous. The energetic level is comfortable. Each point is treated from 30 seconds to 1 minute. The hand zone treated on Sue-Jock conformity system to the head and neck color zone. The mode is continuous. The energetic level is comfortable, 2 minutes. The apparatus operates on damage zone in continuous mode, on healthy zone in individual dose 1. If there is a left side hemiparesis, left arm and left leg are damaged, the damaged surfaces are treated in continuous mode. The apparatus operation begins from the fingertips, it stops on one point for 2-3 minutes. The extremity is treated from 2-4 sides. Further, according to tetrasymmetry, the sound leg is treated in dose mode from 1 or 4 sides. It's treated downwards. The apparatus operates on the ill extremity. The direction is upwards. The mode is continuous. The energetic level is comfortable. The speed is 1 cm per second. Then, the sound arm is treated in dose mode on comfortable energetic level. The neck color zone. The operation is held on minimal energetic level, moving apparatus with a speed of 1 cm per second. The operation time is 10-15 minutes.
При заболеваниях кожи
In case of skin disease, the zones with maximal changes, where the rush is multiple, brighter or making a spot, are treated in continuous mode on comfortable energetic level. In this case, skin as a direct projection is treated on the square not more than the square of two patient palms. The rules are as follows. By the changed skin, the apparatus is not transposed.
переставляется.
Trophic ulcers can complicate the course of many diseases: sugar diabetes, thrombophlebitis, bed sores, and so on. The Denas and Denas-therapy operation in combination with melphalan leads to improvement of blood microcirculation around the ulcer. This encourages the skin damages and disease elimination and creation of fresh skin. The ulcer is treated on the injured body. The electrodes touch both damaged and sound surfaces. From session to session, the treated injury square narrows. The mode is continuous, the energetic level is comfortable or minimal. The apparatus is transposed. Stop on one point is 1-2 minutes. Do not forget about melphalan.
Для улучшения внешнего вида, для улучшения...
In order to improve the appearance and skin statement, it's possible to treat the face. In this case, two ways of influence are possible. The first way is the operation in continuous mode on maximal bone energetic level, in a mode of electric neurostimulation, when the symmetric parts of face are treated with the apparatus only transposed. In this case, the apparatus stands on symmetrical parts of face at the same time. The second way of face treatment is as follows. The face is treated by gliding movements on comfortable energetic level on the skin tension lines, on massage lines from the face central line to periphery. Around eyes, the apparatus is transferred from outer eye angle to the inner one on the lower lid and from the inner angle to the outer one in the upper lid. In case of obesity and cellulites, the treatment is held in continuous mode on maximal energetic level. The maximal change zones are treated on breeches, the front abdomen wall, on thighs. In this case, the apparatus is only transposed. Under obesity, the metabolism change is understood. It's characterized by the significant growth of fat tissue, increase of fat cells number and fat content in them. In case of little weight addition, it influences only the appearance, but a range of organs is also subjected to danger. The normal weight and conforming deviation from the average value are different depending on the age and neurological, endocrine and metabolism determined individual constitution. For its determination, there are various formulas. The simplest one says that the ideal weight in kilograms is equal to height minus 100. From the physiological point of view, in case of obesity, there is incoherence between received calories and physical work. In case of Denas-therapy influence on the human organism, the metabolism increases, the activity of endocrine and neurological system improves, that leads to the body mass decrease and fat tissue decrease. The abdomen skin is treated by the cross method. The orientation is made on the navel and the apparatus constantly moves away from it. The mode is continuous. The energetic level is maximal. It is also possible to operate in continuous mode by radial slow movements in direction from navel. In case of cellulites, the operation is held in its direct projection. The mode is continuous. The energetic level is maximal. The apparatus movements are radial. Stops are made on the places of maximal fat formation. The operation is held in the same way on symmetrical areas. If a woman bothered by wrinkles, the apparatus operates on their maximal accumulation place in continuous mode on comfortable energetic level for 5-7 minutes. If the aim is to improve the face soft tissues tonus, the apparatus operates in dose mode, beginning with the face central line on massage lines, from the chin to ear, from the mouth angle to ear, from the nose wing to ear, and so on. If it is a young woman, the apparatus operates by massage movements. If it is an elderly woman, the massage movements are not used. Skin should not be tensed. Among the spine diseases, the most frequent are osteochondrosis of spine, different damages of carriage, kyphosis, scoliosis, kyphoscoliosis. There may be intervertebral hernias. In presence of these diseases, there are pains in the back frequently strengthening or appearing in motion. In this case, the maximal pain area is treated continuous mode. The rule is as follows. The stronger the pain, the bigger energetic level could be used in operation. In case of joint diseases, when the patient is bothered by pain, there may be swelling and blushing of skin over the joints. The treatment is held in the maximal pain zone in continuous mode, transposing the apparatus upwards. The ill joint area is treated. Deformation arthroarthritis and polyarthritis. The inflammatory process occupies consequently the junction tissues of the whole body. First of all, in the area of joints. Into the inflammatory process, all the parts of joint are involved. The synovial membrane of joints thickens, becomes rough. The synovial liquid volume increases and sometimes significantly. The joints lose their calcium that provides their strength and hardness. The bone tissue destruction begins. At the same time, on the cartilages covering the joint joint surfaces, the unripe cells are laying. They increase the friction inside the joints and limit their moving ability. Often the disease begins slowly, and the common statement deterioration comes very soon. The patient loses appetite, loses weight and feels unsound. The pains in joints often appear in connection with some certain event, injury, cooling, emotional strain and others. That cannot be considered as a direct reason of the disease, but as provocative factor. Then gradually the illness appears that is directly connected with the joint's damage. Denas and scanner-apparatus operation leads to improvement of blood microcirculation around the damaged joints and in marrow that leads to partial or complete their recovery. The apparatus operation begins from sound joint in individual dose mode. The joint is treated from three sides. The underknee pit is not treated. Then the operation transfers to the heel joint. During the patient moving, the maximal pain point is determined. The electrodes are put on this zone for 10-15 minutes, the mode is continuous, energetic level is maximal. The underknee pit is not treated. In case of lower extremity diseases, the lumbar sacrum zone is treated. In case of upper extremities joints diseases, the neck collar zone is treated. Besides the seventh neck vertebra, jugular pit and common zones are treated.
При заболеваниях lower organ.
In case of ear, nose, throat diseases, the treatment is held from the maximal pain place. In case of ear diseases, that may be otitis, neurosensor impaired hearing. The ear and around ear zones are treated in continuous mode. In case of throat diseases, that may be tonsillitis, laryngitis. The front surface of neck with the mouth diaphragm is treated. It's possible to operate from the tongue. In this case, the apparatus is put on the tongue back in continuous mode on minimal energetic level for 2-3 minutes. In case of nose diseases, in everyday practice, it is usually rhinitis, when the patient is bothered by the nose blockage and nose secretions. The nose, wings and bridge are treated in continuous mode. The operation is held till the statement improvement, till the nose breathing recovery.
Улучшение самочувствия до восстановления носового дыхания.
Neurosensing impaired hearing is determined by the damage of sensitive nerve cells of internal ear, hearing nerve and central formation of hearing system. Neurosensor impaired hearing most often appears as a result of sharp infection diseases, side ototoxic medicines activity, production and daily life noise, and vibration influence, organism intoxication with carbon dioxide, mercury, lead, manganese and others, inherited pathology and so on. In case of Denas-therapy influence on the human organism, the inflammation is eliminated. If at least 25–30% of the hearing nerve is not damaged, the hearing recovers. The ear shell and area around it is treated. First, the operation is held in individual dose mode with revelation of pathological zones when the apparatus is transferred to continuous mode. The operation time is 2–3 minutes. The ear shell and ear lobe is treated in individual dose mode. In the zone of neck ring, the neck is treated by the apparatus in different directions, from spinous processes and to spinous processes in other direction. The mode is individual dose. The temple zones and closed eyes are treated. The apparatus operates on eyelids. The mode is continuous. Energetic level is minimal for 1–2 minutes.
При глазных заболеваниях, когда у пациента могут быть
In case of eyes diseases, when patient can feel pain, have a feeling of sand in the eye, the vision sharpness can fall. The eyes area is treated. The apparatus is put on the closed eyelid on minimal energy for 2–3 minutes.
на 2–3 минуты.
Age farsightedness is the age insufficiency of the eye accommodation slowly reflecting by progressing worsening of uncorrected vision in work at close distance. There happen albuminoid concentration increase, yellowish shade enforcement, core and lens capsule thickening and its elasticity decrease under transparency preservation. The main symptoms of the age farsightedness are difficulties in watching of fine objects at close distance. Fast already 10–15 minutes minutes of vision work, fatigue of cilia muscle reflecting in letters and lines fusion, feeling of strain and pain in upper nails of eye, eyebrows, bridge of nose, more seldom in temples, sometimes even till nausea, a light photophobia and tearing. Denas and Denas-therapy operation leads to improvement of blood microcirculation around eye. As a rule, the operatic correction of vision by 1-3 diopters. Closed eyelid. First, the apparatus operates in dose mode, then it transferred to continuous mode. Minimal comfortable level 2-3 minutes.
При заболеваниях полости рта.
In case of mouth cavity diseases, toothache, inflammatory processes, pulpitis, stomatitis, glossitis and gingivitis, the treatment is held on shoal zone in continuous mode. The apparatus is transferred from temple area to the face central line by lower jaw and by upper jaw.
По нижней челюсти и по верхней челюсти.
Pulpitis. The tooth enamel is covered by fine soft film pellicula that consists of saliva proteins. On it the gems living in the mouth cavity stop. The gem concentrations form dense film. The basis of this film are badly soluble polysaccharides. They encourage microorganisms to stay on the tooth surface. Apart from the gems, numerous microorganisms take part in the tooth destruction. At first, only the tooth enamel is damaged. Chalk-like spot appears. If food or gem pigments stop on its surface, it can obtain yellow, brown or black coloring. The dentine layer protecting the tooth pulp from thermal chemical influences becomes thin. This determines toothache appearance from something called a sweat. Bacterial toxins coming through the thin dentine layer can cause tooth pulp damage. Its inflammation, pulpitis, develops. In case of Denas and Denas-therapy influence on the direct projection of the ill tooth, pain and inflammation is eliminated after what the main disease treatment at dentist is necessary. The apparatus operates on the direct projection of the maximal pain area. The mode is continuous, comfortable or maximal energetic level, till the pain decrease or elimination. Further, the submaxillary area is treated in continuous mode, transferring or transposing the apparatus. The sound side is treated on dose mode. The neck ring zone is treated in several directions. In case of gums hemophilia, the Scholl method is applied. The mode is continuous. The apparatus can be moved or transposed from one and another side.
Принципы работы по неотложным состояниям.
Imperative statement separation principles. Operation is held only in continuous mode. The operation termination criterion is the patient exit from dangerous statement or transfer of the patient to specialists. If the patient is in consciousness, the treatment is held on maximal energy.
Максимальной энергии.
In reanimation zones, the apparatus operates in continuous mode on maximal energetic level. The operation is held till the patient statement improvement. No steep area, upper lip and chin area. Heart front direct projection. Antispasmodic zones, upper lip. Palm from both sides. Temperature decrease areas. The carotids direct projections are treated. Continuous mode, comfortable energetic level, 1-20 seconds on each zone. Axilla is treated from both sides. Elbow flexion. Under-knee pit. Thigh inner surface.